Thank you, Madam Speaker, for allowing me to present my thoughts on the 2017-2018 appropriation bill, specifically in response to the health budget and issues for the Northern Division. Regretfully, Madam Speaker, I focused my comments on the state of our national healthcare system and the budget allocations presented to us. While the health budget is still centrally managed, the issues I will raise are magnified for the electorate in the Northern Division, where I am from and where I live, and undoubtedly similar for the West and the Outer Islands. In the health budget, the current government has presented to the people of Fiji unreal, piecemeal solutions that will not cure our health and medical services delivery. The increased allocations for projects are mere promises that have been untouched in the last 3 years under requisition. Every public servant knows that projects pegged under requisition have a small to nil chance of completion. In essence, it is aspirational or wishful. There are no new projects for which funds have been actually committed. Even the talked-up National Kidney Research and Treatment Center, to be managed by nephrologist Dr. Amrish Krishnan, costing $1 million, is under requisition. Additionally, the government should have allocated funds to provide free kidney dialysis to low-income earners, but the $300,000 allocation has not changed despite pleading by kidney patients. And this budget had made allocations for other things like hiring of consultants to improve government's image, marketing grants, golfing, and to the Fiji Broadcasting Commission. Aid by donor partners factored in on page 142 of the budget estimates is largely technical support, with an attached dollar value not addressing the true budgetary allocation per se. Let's look at the ratios, Madam Speaker, for health and medical services. The ratio of health to government expenditure to date for Fiji is 9.4%. The World Organization recommended ratio is 14.4%, while for low and medium income countries, the average recommended ratio is 11.6%. And let us look at the 27-2018 budget, then in terms of health to GDP ratios. Fiji's ratio is 4%. WHO recommends a 5% minimum ratio. The low and minimum income countries' recommended ratio is at an average of 6.6%. Fiji's 2017-2018 budget in terms of health to GDP ratio is 4%, and again, far below the recommended ratio. I now turn to our health expenditure breakdown. While the state bears the burden of 66% of health expenditure, the out-of-pocket cost borne by the taxpayer is 34%. This means that taxpayers are shouldering additional burden on top of their taxes. 34% is for health expenses, most of the time unplanned for, that Madam Speaker. For our vulnerable and poverty-stricken people, getting sick means they are further entrenched in the darkness of poverty. For those in the middle class, it means they can dive into poverty. It means that houses become mortgaged and loans need to be taken just to ensure that their loved ones can undergo medical treatment. This is the sad, painful, and unmistakable reality. The state of our healthcare in Fiji right now means that if you become ill, if you have the means, you have a fighting chance. If you are poor, the odds are heavily stacked against you. Madam Speaker, turning on to our medical professionals, the announced recruitment of 3 tranches of specialists is wishful thinking. When the bold promise of 33 specialists in the first tranche was announced, this is on top of previous promises of additional medical personnel over the previous 3 budgets. So where are they? By now, Fiji should be teeming with these medical professionals, should it not? We are aware that there is one ENT, ear, nose, throat specialist that was recruited in 2014. The lack of specialists is alarming. Our local medical personnel are being submerged at the expense of wholesale expatriate recruitment. The recruitment drive in India early this year, Madam Speaker, may help, but we need to build on our local expertise as much as we can. There are obviously 75 places for local recruitment at the ground level. These 75 internship level spots need to be filled every year, but this number has just been met in 2015 to 2017. This means we are still playing catch-up in terms of health internship. manpower needs. There are batches of medical students from Cuba and other overseas destinations due here shortly to address the shortfall in numbers. But the sudden urge to raise these numbers overnight is an exercise in futility. Madam Speaker, to advocate the situation, our Fijian-made medics returning from abroad are given a difficult time upon their return. They could have quality current setup in specialist areas, but it's not happening. Obtaining a full complement of additional doctors is not the total solution. What will the additional numbers mean when the ministry cannot provide the appropriate beds, medication, technology, or if the consumables are out of stock? We understand that new specialist units such as the urologic, cardiac team remains without medication and operative equipment. Most are not fully operational, yet our Fijian-made medics have been trained locally and exposed internationally for these roles. Can we see the mismatch in these issues? Health systems are not built on numbers alone. The building blocks of healthcare include: 1. Adequate and appropriate facilities and infrastructure. 2. Sufficient supplies of medicine and consumables. Adequate health financing. 3. Improved health information, cross-cutting leadership and governance. And 4. A content, inspired, compassionate and accountable workforce, all working towards exemplary healthcare service delivery. Our medical graduates do not always move to green pastures on their own accord, but are pushed out by poor administrators, planners and politicians. Evident now by this year's fast-track amendment to the medical and dental practitioners. To our healthcare system's demise, the push factor is greater than the pull factor. Increasing the intake at medical schools, mid-level study in areas of clinical interest and provision of scholarships serve to keep the locals on their own turf. Madam Speaker, turning now to our NSS pay rise, the much-lauded civil service reform seems to have been short-circuited with the pay rise for salary increases. Shockingly, the job evaluation questionnaire circulated by PwC to nurses as part of the civil service reforms seemed generic and off-the-shelf templates that offered no appreciation for the complicated pressures, structures and often overlapping roles shouldered by our nurses, nor the extra effort needed on top of workloads to complete these unnecessary and complicated details. The nursing pay rise is a welcome relief, but is at odds with the ratio of the pay rise given to doctors last year, and which a cohesive and seamless job evaluation exercise would have addressed. The nurse practitioner's salary increase by 75% is commendable, but there are just under 40 nurse practitioners who will benefit from this. Our midwives in the maternity areas are struggling, and a 25% incentive would have been more appropriate. Again, a cohesive and seamless job evaluation exercise would have addressed these disproportionate increases. But then, what of the state of the nursing cadre who have been weaved into the administrative services by way of career progression? Are the 25% increase? What of the specialist nursing structures? Should they be realigned? If the lack of realignment continues unaddressed, corrupt practices can emerge. The nurses' salary increase of approximately 15% is acknowledged and appreciated, but again, a cohesive, seamless job evaluation exercise would have addressed these disproportionate salary ratios. The mid-level training of nurses needs urgent review. Birthing surges in the face of facility and infrastructure inadequacies creates adverse maternal and neonatal birth outcomes, and midwifery training is absolutely essential. Madam Speaker, the shocking revelations of the spate of deaths of newborn babies is still fresh on our minds, and we expected more prioritization of our neonatal unit. This now brings me to the issue of our junior doctors who are made to work up to 22 hours straight. Surely, such stress hours are a violation of labor standards in a profession where life and death are daily challenges. Is the ministry actively monitoring these unrealistic and inhumane expectations of new entrants? When the workload was lighter in the past, it was fairly tenable, but the new structure does not even address this. Madam Speaker, the supply of pharmaceuticals and medical consumables the budget announcement made a brief mention of the free medicine scheme, selectively labeling it as medicine subsidies. That is because the scheme is completely dysfunctional. With the stated 140 plus items for release to the public in 2015, the retail pharmacists are still not provided with a list of what is to be dispensed after 2 years of waiting on this announcement. Only about 20,000 people are registered for the scheme, when we know full well that 50% of the population are living below or around the poverty line. If pharmaceutical supplies to our hospitals is inadequate, how is it logically possible for this scheme to still be allocated $10 million and continues to remain largely unutilized in the last 2 years with a high wastage rate? Recall that for the past years, except this year, free medicine has been under requisition. This year's budget allocation for health addresses the purchase and maintenance of health-related high-end equipment. So the question is, are these important pieces of health-related equipment still without service contracts after the warranty period comes to an end? The allocation of $1 million has been put aside for this, but it is our understanding that MRI, CAT scanners, radiology, general lab equipment extra are not in working order as a result of invalid service agreement. In a similar fashion, Madam Speaker, consumables such as lab reagents and chemical reagents for X-rays are out of stock as well. It is our hope that the newly announced National Kidney Research and Treatment Center will also look into renal transplantation with agency. This will allow some patients to benefit from a one-off surgical procedure and not suffer the 3-per-week dialysis lifelong exercise. At great cost, appropriate laws will have to be enacted. Madam Speaker, there are other important health developments that this budget document has failed to address. What is the progress in the developing of the cancer unit? Furthermore, I understand that a senior health official had urged MPs of the threat of the oncoming NCD crisis at a parliamentary workshop a couple of years ago, where even the Consumer Council and other experts made similar pleas. The President specifically requested MPs to put in place tax measures to help alleviate the NCD crisis, which has now reared its ugly head on a national scale. We look forward to the development of a modern mental health clinical training and research hospital, which seems to have fallen off the radar. We are told that support for this establishment was available from a bilateral donor partner with a memorandum of agreement, again sitting on someone's desk since 2013. For our elders, for whom we all owe a great measure of indebtedness, Madam Speaker, the state of the senior citizens' homes, the development of retirement villages, improved and wider in-depth training of caregivers, including the professional cadre, generalists, logists, rehabilitation experts, specialist nurses, enrolled nurses, counselors, field and community workers, palliative public nursing needs agent reviews. And Mahatma Gandhi once said, and I quote, it is health that is real wealth and not pieces of gold and silver. Briefly, Madam Speaker, let me quickly address the infrastructure needs for Banua Levu if we are to transform it into a hub as a part of the government's Look North ideas. One, the Lambasa Airport that is in Waingilia. This airport needs to be able to cater for night flights with some upgrades with lights installed for night landing while we are waiting for an international airport. Secondly, road upgrades. Upgrading of entire ceiling of roads are needed in the Northern Division, especially the trunk roads along the island of Banua Levu. That is, number one, the road from Dongeloa to Natawanadi to open up land for resorts and hotels so that the economic situation will improve. Secondly, the country roads. The road from Namua Boiboi to Ndongea, from Namboalu to Nambalembale, that is in Wainunu, from Nerambale Road Junction Daramu through to Banua Bo. It is important that these roads need to be done up quickly and properly so that people's traveling time will be saved. But we do not see any specific budget for this for these particular roads. It's only when the Prime Minister goes to visit and the roads are being graded and gravelled here and there. Madam Speaker, Lambasa badly needs a bypass road. because the traffic congestion is getting very huge. We have a narrow one-way road, and it is very important that we need to understand that our sugar mill is just past the Lambasa Bridge. So it is very, very important to consider building up a bypass road in Lambasa. And there are many roads which lie within 10 to 15 kilometers from the Lambasa town end. And some of these roads were previously tahsil, but when the tahsil have finished, these roads are gravelled again. So we need specific budget for these roads, and these roads not to be done up very properly, because people mostly now move into urban and peri-urban areas that is just close to the town, because people living in the rural areas do not have those facilities. So it is very, very important that we need all these roads. And some of these roads are the Koroutari, Bakuru Road, Nambekabu, Galewanga and Bodalebu Road, the Buniduidui and Waikisi Road, even the Bombali, Urata and Rekete Lailai and Anube roads. This is something very important. We need very specific budget for this road, Madam Speaker. And we do not see anything in the budget. So that is why I am bringing it here. The problem is when the ministers and the government people go, it's done. It's not only my bus route. I am a bus operator, but it's for the people. I'm only part of it. I'm only part of it. And I'm providing a very good service to the people of Fiji. Flooding, Madam Speaker, Siberia is known for flooding every now and then. And many times, people are left behind, they are unable to travel. So it's very important that we see that flooding at Siberia, at Bunimboli, and also in Bunibutu near the health center, which is often obstructed by flooding. And this particular flooding is very, very common. Madam Speaker, we also request that some budgetary allocations be made for the crossing of people who are living in Tangnipula and Wainikoro to cross over to the Nabalebu Health Center and also to the Nabalebu Secondary School and the college there. Because there is no particular crossing, there were some things, there were some ropes and some boats, there are ferries that were transporting the school children, but they are all gone once, during Cyclone Winston. And the Commissioner Northern's office or the divisional office is not able to provide some funding, and people are unable to do this. So this should be a priority. Shipping cost to Banualevu is very expensive, and one of the reasons that the cost of delivery of services and goods is going up because there is no particular subsidy for spare part dealers, for supermarket dealers and people who do manufacturing. It is very, very important that we need to look at this particular thing. And rural electrification, I know that there is some increase in the budget, but that budget is not sufficient because with the northern division, majority of the places, the power lines are on field trunk roads, but the many side roads, the people that are living in the area do not have power supplies now. And it is important, if we want a knowledge-based society, Madam Speaker, we need to give people the power, the water supply, the basic necessities of life. This is very, very important. And we cannot just go out hand of money here and there, but we need to make these things very, very easy for the people, like Senganga Interior, Bunibere, Seva, the road past Draketi through to Nambawalu, and also from Nadabanandi to Natewa Bay and Buddha Bay. It is very, very important. We need that power supply. It's no use for the Prime Minister to go out in a dozen vehicles with the people around him and do nothing. Big talk, no walk. We don't understand what the Prime Minister is trying to say. So it's very important, Madam Speaker, power supply to Naibitia, Wabwabu and Bunibutu, and also from Ulumbai School to Bonikabula. We want to give tablets in the school. How will they use it? Where is the power? We want our children to be knowledge-based. We need electricity for the IT users. For sports, Madam Speaker, it is some consternation that there is no public swimming pool for the northerners, and that is in Lambasa and Sabu Sabu. While we hear in the budget announcement a specific swimming pool for this island, but for Banualevu we do not have. Our children also need to be able to learn to swim properly. The northern division is very, very neglected. Madam Speaker, on the sugar industry, it is very, very important that the price of sugar, as the National Federation Party leader had said, that the price of sugar cane should be a minimum guaranteed price of $100. With that particular subsidy in the fertilizer, it will not do much because the sugar industry is lagging behind, just like the $8 tourist industry playing golf about, I think, $9 million, $18 million to the Fiji Airways. Why can't we give about $50 million to the sugar industry to improve the sugar industry? Does the government have the gut to do that? No. Madam Speaker, this is something very important. Our tram lines need to be improved, and I thank you, Madam Speaker, for the opportunity of contributing to the budget.